Are you wondering about how your toddler's speech should be developing around the time that your toddler is turning one, or maybe they've just turned one and they're between that 12-month to 18th month period? Well, you've come to the right place. My name is Amini. I'm a speech and language pathologist with several years of experience. I also have my own private practice, Smarter Speech, in the Bay Area, California. And my mission with this YouTube channel is to help parents, especially those with children under the age of 5, feel empowered with knowledge and tips about speech and language development, because below the age of 5 is when a child's language and speech are developing so rapidly. In fact, most of their brain development is happening, and you have the foundations for their learning in the later years. So being armed with more information is better. Going back to our question, what speech milestones should you look for as early as a year old? Well, the first thing I want to do is point out a very key distinction. So there is a difference between speech and language, and you won't hear those used interchangeably when it comes to speech therapists. Language is the content of what your child says. So language is things like how many words your child is saying or whether your child has said their first word. If you're looking for language milestones, I would definitely check out my channel. There's a whole section on language milestones. But this is speech milestones. So speech milestones are the sounds that your child is starting to say and acquire. It is also how clear your child is. And believe it or not, the foundations for this start just at the age of 1 year old, just when your child is starting to get their first words. Maybe they haven't even gotten their first words yet, but the foundations of speech are already building. So the first thing that I look for, the first milestone in a child who's around a year old, is the ability to make bilabial sounds. That sounds very fancy, but all bilabial means is it sounds that use the lips. So sounds like p, b, and m, or sounds that use the p letter, the b letter, and the m letter. So usually I look for p, b, and m in daily objects or in daily things that they might be saying. So are they able to say something like ma or mama? That shows me that they're able to do the bilabial sound. Are they able to try to say something like pop? Pop, again, has that p, that bilabial sound. Or are they able to say something like ball, or at least try to talk about a ball? So that's our B, another bilabial sound. So the main thing that I look for again is that the lips are coming together to make that sound. And that's one of the first sound that develops. So even before T and D, you're looking at P, B, and M. The second speech milestone that I'm looking for is the ability to use these consonants in something called a CVCV word shape. Again, that sounds very fancy. It is not. A CVCV word shape is just a consonant, vowel. So things like baba, mama, papa, dada, bonus, because T and D might be there, might not be there yet. Dada, nana. So those should be happening. So your child essentially should be babbling by now, right? You should be hearing a lot of buzz, mamas, papas. But you will also see that babbling start to become a little bit more intentional and a little bit shorter. So with mama or with baba for bottle or with papa or something like that. So you should see at least a few of them, CV. If you notice the consonants in both the syllables tend to be the same. So pa, ba, etc. starting to come in. So that's the main word shape that I'm concerned about right now. The child should have their initial consonants. So that's the b. The initial consonant sound should be there. I wouldn't worry too much about the consonants at the end, but initial and middle should definitely start to come in, especially with P, B, and with M. So the last milestone that I look for is intelligibility. So you might hear intelligibility a lot, especially when you talk to a speech therapist. Intelligibility is essentially how clear your child is. This is a little bit skewed because most moms and dads completely know what their child is saying. It's almost this telepathic connection. But for an unfamiliar listener, how intelligible or how understandable is the child? So at the age of 1, luckily, because they're saying so little, a child should be understood by an unfamiliar listener only 25% of the time. Meaning, out of 4 things that your toddler says, it is okay for 3 of them to really not make sense. So that's really good news. But at the same time, it is worthy to note that out of 4 things that your child says, at least one of them, grandma or grandpa, should understand or should have an idea what exactly is going on, especially if your child is using the p, b, and the m sound. So those are our 3 milestones, but I do want to talk a little bit about language versus speech before you can click off of this video. The main thing that I want to talk about is at the age of 1, it is more important to focus on language or content than it is to focus on speech sounds. The reason is because what's most important is that your child's brain right now is rapidly acquiring vocabulary, is rapidly learning what different things are, what different words mean, and that should take priority. If you're starting to worry about the clarity of the speech or correcting, that's really not the right way to go. So what you do want to do is you want to focus on having your child hear as many words as they can, labeling lots of words for your child, and just really creating this language-rich environment. But while you're doing this, is it of worth to listen for these 3 things? Definitely. So again, P, B, and M, the lips should be coming together. If they are not, that is definitely something that you want to mention to a pediatrician or to a local speech therapist or a speech pathologist. The p, b, m is very important. If that's not happening, there might be some oral motor weakness. So there are definitely some conditions, some medical conditions where a child is not really able to get that seal on the lips. So you want to make sure that that is clean. If you're not hearing that much babbling or that much of the CVCV, that's also something to mention to a pediatrician. It's very important to not wait to see what's going on, to get any testing needed, or to reach out to a speech therapist. And with the intelligibility, it's just a good thing to keep an eye on. So as you're interacting and playing with your little one, just keep an eye out to see that you can understand, or your friend can understand, at least one of the things out of the 4 that they are saying. So those are our 3 milestones. And again, earlier intervention is better. If you're concerned for any reason, listen to your intuition, make that appointment with your pediatrician or your speech therapist. I hope that helped you. If you are looking for more tips, these are just 3 very general milestones, but if you want to go into more detail, up to 10 or up to 50 tips, there are some resources in the link in the description box below. There's our mailing list with our monthly free tips on speech and language development. There's also a book on, or an ebook on speech development in toddlers. There's also our course for speech development specifically in toddlers. And finally, there's other links and resources that I've also posted down there that I think could be important. So feel free to look through those. Feel free to look through more milestone charts. But for the most part, these are the 3 things that I look for when I look to see how a toddler or a 1-year-old is speaking. I hope that this video helped you. Thank you so much for watching, and happy talking.